All right, welcome back to the deep dive. We are diving deep today into a stack of information you sent our way: articles, research papers, notes, all focused on a really specific corner of canine health. Our goal, as always, is to kind of cut through the noise, pull up the key insights, maybe find some surprising facts so you can feel really informed on this. Let's jump right in. We're talking today about something called canine urethral prolapse. Just hearing that term or seeing it described can sound pretty alarming. So based on the material you've shared, what exactly is this condition?
Okay, yeah, let's unpack this. According to the documents you sent, canine urethral prolapse is basically when the inner lining of the urethra, that's the tube carrying urine out, it actually pushes out or protrudes right through the opening at the tip of the penis.
Okay.
It's described as relatively uncommon, but like you said, the visual is pretty striking. So our mission here, with your sources, is to figure out what causes it, how it's diagnosed, the treatments, and what the outlook usually is.
And speaking of that visual aspect, because the sources really seem to highlight it, what does this actually look like? What would an owner see?
Yeah, the sources are quite descriptive. You typically see this distinct red rounded mass sticking right out from the tip of the penis.
Red and round, okay.
And the size can vary. Sometimes it's small, like a pea. Other times maybe up to cherry sized. Some sources even mention it looking kind of donut shaped.
Yeah, donut shaped. Interesting.
And an important point is the size can change. It might look bigger or more obvious if the dog's excited or, straining.
Gotcha. And the material you sent mentions bleeding. That's often the first thing someone notices, maybe even before they see the mass.
That's right, yeah. Bleeding's a really common first sign that often happens spontaneously, just out of the blue. Could be intermittent, like on and off, or sometimes continuous. The sources call it sanguineous discharge or hematuria, basically blood coming from the urethra. It happens because that tissue that's sticking out is delicate, gets congested, and just bleeds easily.
Right, congested tissue. Makes sense.
Owners might also notice the dog licking or chewing at itself a lot down there. It's irritated, probably painful.
Poor thing.
Other signs can be like straining to pee, what we call dysuria or stranguria, or just seeing blood in the urine itself. The sources do warn, though, if the swelling gets really bad, it can actually block the urethra. That makes urination tough or even impossible.
Oh, wow.
And that is a serious emergency situation. Needs immediate vet attention.
Definitely. Okay, so you see this red thing, maybe bleeding, the dog's uncomfortable. Who usually gets this? Does it affect certain dogs more?
It does. The pattern is pretty clear from the sources.
Yeah.
Most common in young male dogs.
Yeah.
Especially ones that haven't been neutered.
Young, intact males.
Okay. And there's a very strong breed link. English bulldogs are mentioned over and over as being highly overrepresented.
Bulldogs, right. I think I saw that mentioned.
Yeah, and Boston Terriers, pugs too, those sort of short-nosed brachycephalic breeds. Yorkshire Terriers also get a mention.
Interesting. And the age?
Typically young. Average age mentions around 18 months, but the range is like 4 months up to maybe 5 years old.
Yeah.
And interestingly, the material says it's like extremely rare in cats, really a dog thing.
Huh. Okay. So young, intact, male, bulldogs, Bostons, pugs. That's quite specific. Now, here's where it gets really interesting for me. Let's talk about the why. Why them? Why does this happen? The sources mention weakness and pressure.
Yeah, exactly. The way the sources explain the pathophysiology, how it develops, it seems to be about either some weakness in the structure supporting the urethra or increased pressure inside the urethra. Or, often it's probably a bit of both.
Okay, weakness and pressure.
And those factors that increase pressure or cause straining are really key. Things like excitement, sexual arousal. Yeah. That's highlighted as a major factor, especially in intact dogs.
The excitement link.
Yeah, that repeated engorgement of the tissue during excitement can sort of push it out over time. Other things mentioned are like masturbation or excessive licking, chronic straining from other problems, maybe UTIs, bladder stones. Yeah, uroliths or prostate issues, even chronic constipation. Anything that makes them strain down there. Obesity is also listed as maybe contributing.
That makes sense. Lots of things putting stress on that area. But let's go back to that breed thing. It's so striking. Why the bulldogs, the Bostons, those brachycephalic dogs?
It really seems to point towards a genetic predisposition, likely tied to their whole body shape, their conformation.
Their build.
Yeah. And what's fascinating, something the sources really dig into, is how their breathing issues might be linked.
Wait, they're breathing? How?
Well, you know how those breeds often struggle to breathe easily? That increased respiratory effort can lead to chronically higher pressure inside their abdomen.
Oh, wow. Okay.
And there's a theory presented in these papers that this constant high abdominal pressure might actually make it harder for blood to return from the back end through veins called the pudendal veins. If that venous return is impaired, it could cause blood to sort of back up and cause congestion, engorgement in the tissues around the urethra.
Making it more likely to pop out.
Exactly. Makes that tissue more prone to prolapse. They also mention maybe just an inherent weakness in the urethral tissues themselves in these breeds. Less common causes mentioned are things like inflammation of the urethra, urethritis, or maybe even trauma. But what's really key here and fascinating is how it's often not just one thing. It's like the breed structure causing higher pressure, plus maybe some sexual excitement, and maybe an underlying UTI causing straining. All these factors can kind of converge to create the perfect storm for the prolapse to happen.
Wow. So their breathing problems could actually be connected to this problem, way down at the other end. That's a really surprising connection from these sources.
It really is. It shows how interconnected things are in the body,
Definitely. Okay, so if you see these signs and you have some idea why it might be happening, how do vets actually diagnose it? You said it's often visually obvious, but there's a critical step.
Yeah, the diagnosis itself is usually pretty straightforward. It's largely based on seeing that characteristic red mass at the tip of the penis and the owner's history, saying they saw the mass or unexplained bleeding. The physical exam involves gently looking at the penis, confirming it's there, feeling it.
Okay.
But the really crucial step the sources emphasize is ruling out other things that could maybe look similar.
Right. Make sure it's not something else.
Exactly. Could it be a foreign object stuck there? Some other kind of penile mass or growth, like certain tumors, CTVT, squamous cell carcinoma, mast cell tumor, or even just simple trauma, or maybe a structural issue like a persistent frenulum or a fracture of the penis bone.
So lots of possibilities to rule out.
Yeah, or inflammation like balanoposthitis or urethral inflammation, stone stuck there, urethral cancer. You need to be sure it is urethral prolapse.
Makes sense. Confirm the main diagnosis first.
Yeah.
And then you mentioned ruling out the underlying causes, too, the things that might have triggered it. What tests help with that?
Right. Finding any underlying triggers is key. For that, the sources recommend some standard diagnostics. Urinalysis is essential testing the urine.
Urinalysis, got it.
And usually a urine culture and sensitivity, too. That checks for bacteria, a UTI, and tells you which antibiotics would work. Because a UTI could be the cause of the straining that led to the prolapse. Or it could actually be a complication resulting from the prolapse. So you need to check.
Okay, check the urine thoroughly. What else?
Abdominal x-rays are typical. They look for bladder or urethral stones that show up on an x-ray, and they help evaluate the prostate gland, especially in intact males.
That's right, is it right?
Sometimes, if x-rays aren't clear, they might need specialized ones using contrast dye called cystography or urethrography to see stones that don't show up normally or other urethral issues. A physical exam of the prostate, maybe an ultrasound of it, also important for intact males. Blood work, like a CBC, might be done, especially if there's a lot of bleeding, to check for anemia. Maybe a clotting test if the bleeding seems excessive or unusual. Usually the sources say you don't need to biopsy the prolapsed bit itself, the look is so typical. But if it looks odd, a biopsy might be considered to rule out cancer.
Oh, and they mentioned sometimes checking the penis during erection could be useful if the prolapse only seems to happen then.
That's quite a bit of detective work. Seems thorough. Okay, so once it's diagnosed and hopefully any underlying causes are found, how is it treated? You mentioned a couple of paths earlier.
Yeah, the sources lay out two main approaches: medical management and surgical management.
Medical first.
Medical management is often tried first, especially if it's a mild case the first time it's happened or it's very recent, acute. The goal is basically temporary relief, reduce the swelling and pain, hope it goes back in on its own.
How do they do that? It involves carefully cleaning the area, lubricating the tissue. Sometimes they try to gently push it back in, manually reduce it. Using things like hypertonic saline or sugar solution can help draw out some of the fluid, reduce the swelling, the edema, making reduction easier. Cold compresses can help too.
Okay.
They'd also use anti-inflammatories like NSAIDs for pain and swelling, antibiotics if infection is suspected, maybe stool softeners if constipation is making the dog strain. But, and this is critical, stressed in the sources, an e-collar, the cone, is absolutely essential.
Yeah.
Non-negotiable.
To stop the licking.
Exactly. To prevent the dog from licking or chewing at it, which just makes everything worse, causes more trauma. The big downside, the limitation the sources point out, is that medical management often only works temporarily. The prolapse is very likely to come back.
Especially with excitement.
Especially during excitement, yeah. So, strict sexual restraint is vital if you're trying this route. It often doesn't provide a permanent fix.
So it sounds like medical management is maybe a temporary measure, but not the long-term solution usually. Is surgery the main fix then?
Yes. Based on these sources, surgery is generally seen as the definitive treatment, the one most likely to provide a permanent solution.
When is it recommended?
It's typically recommended if the prolapse keeps coming back, if the tissue is badly damaged, or just if medical management fails. The most common surgery described is called a urethropexy.
Urethropexy, okay. What does that involve?
Basically, the surgeon removes the prolapse tissue that's sticking out. Then, they carefully stitch the remaining healthy edge of the urethral lining to the skin at the tip of the penis.
So they kind of tack it down.
Essentially, yeah. It anchors the urethra in place, helps stop it from prolapsing again. The sources do mention a less common way, just pushing it back and stitching without removing tissue, but they say that has a higher risk of it coming back.
Got it. Resection and stitching seems standard.
Now, here's another really important point, strongly emphasized in the sources, especially for intact males.
Let me guess, castration.
You got it. Castration, neutering, is highly recommended at the same time as the urethropexy surgery.
Why is that so important?
Because, as we discussed, sexual excitement is a major trigger, a huge risk factor for it happening again. Neutering significantly reduces that hormonal drive and excitement behavior, which dramatically lowers the chance of recurrence after surgery. It's a key part of the long-term success.
That makes total sense. Address the trigger. Okay, what about after the surgery? Recovery.
Post-op care is crucial. And guess what's essential again?
The e-collar.
The e-collar. Absolutely vital. Usually for about 10 to 14 days to protect those stitches. The dog will also need antibiotics and pain meds. Often a soft diet for a week or two is recommended, just easier on them. And restricted activity, no rough play for maybe 2 or 3 weeks while things heal.
Standard post-op stuff.
Pretty standard, yeah. The sources also mention some newer findings, studies suggesting certain ways of stitching, like using a simple continuous pattern, and maybe giving sedation right after surgery to keep the dog calm, might help reduce complications, like bleeding or the prolapse coming back.
Interesting technical details.
Yeah, and they also mention using a CO2 laser for the surgery as discussed. Potential benefits, like less bleeding during the procedure, but it needs careful technique.
So what does this all mean? Summing up the treatment part, it sounds like surgery plus neutering for males is really the way to go for a permanent fix.
Yes, that's definitely the strong message coming through from this material regarding the most effective treatment strategy. Medical might be tried, but surgery offers that definitive resolution.
Okay. Looking ahead then, once a dog's been treated, surgically preferably, what's the prognosis? What's the likely outcome?
The prognosis, according to these sources, is generally quite good, especially with the right surgical approach. Yeah. While medical management alone often leads to recurrence, surgical correction, the urethropexy, especially combined with castration, usually offers an excellent prognosis for long-term resolution. Most dogs recover completely.
That's great to hear. But are there potential, bumps in the road after surgery? Any complications mentioned?
Yes, like any surgery, there can be complications, though the overall outcome is good. The most serious one, the sources highlight, is something called urethral stricture.
Stricture? What's that?
It's basically a narrowing of the urethra right at the surgery site. Scar tissue can sometimes cause it to narrow down.
And that's bad because?
It's bad because it can make it difficult for the dog to urinate. They might strain a lot, have a weak stream, or in severe cases become completely blocked, unable to pee at all.
Which is an emergency again.
Absolutely an emergency. The sources stress that really careful, meticulous surgical technique is crucial to minimize this risk.
Okay, stricture is the big one to watch for. Anything else?
Other potential issues mentioned are things like dehiscence. That's where the stitches might break down or the wound opens up. Postoperative hemorrhage, bleeding after surgery, though some techniques might reduce this risk. And recurrence is still possible.
Even after surgery and neutering?
It's much less common, but yeah, it could still potentially happen. One study mentioned found a 57% recurrence rate, which sounds high, but they suggested it might be linked to cases where maybe an underlying cause wasn't found and fixed, or perhaps the dogs weren't kept calm enough with sedation right after surgery.
Okay. So finding those root causes is important.
Very important. But generally, the sources reassure that complications, while possible, are usually manageable by an experienced vet surgeon.
Good to know. Finally, let's talk about communicating this to owners, because seeing this must be quite alarming. How do the sources suggest vets talk to pet parents about it?
Yeah, client education is super important here. The sources really emphasize acknowledging the owner's concern first because it does look alarming, the bleeding and the mass, but then offering reassurance that it is treatable.
Okay, acknowledge and reassure.
Explain the breed connection, if it applies, and how things like excitement or straining play a role. Make it clear it's a painful condition causing bleeding. Then, discuss the treatment options clearly. Medical, explaining it's often temporary, and surgical, explaining it's the definitive fix, and really emphasizing that strong recommendation for neutering intact males and why it helps prevent it coming back. That's crucial.
Explain the benefits of neutering in this context.
Exactly. Highlight the high success rate of surgery for a long-term cure, but also be totally transparent about the potential complications, especially urethral stricture. Explain what it is and tell owners exactly what signs to watch for after surgery, like straining, difficulty urinating.
So they know what to monitor for.
Yes. And stress. Stress, the absolute necessity of that e-collar after surgery, how vital it is to prevent self-trauma. They also mentioned discussing costs openly, and when maybe seeing a specialist might be a good idea for complex cases.
That sounds like a really good communication plan. It really highlights that partnership between the vet team and the owner, doesn't it?
Absolutely. Good communication is key for the best outcome.
Well, we have definitely journeyed through these sources today. We've covered what canine urethral prolapse is, what it looks like, dug into the why, including that surprising breathing link in some breeds, how it's diagnosed, the different ways to treat it, and what to expect afterwards, both the good prognosis and potential issues.
Yeah, I think the main takeaway from these documents is that while it looks scary at first glance, it's usually pretty straightforward to diagnose. And importantly, it generally has a good to excellent prognosis if you go for that definitive surgical treatment, especially pairing it with castration in intact males.
It really does raise an interesting thought, though. Thinking about how we've selected certain traits in breeds over time, like the look of those brachycephalic dogs, and how sometimes those very traits can unexpectedly intersect with health vulnerabilities like this. Recognizing these kinds of specific links seems so critical for giving our pets the best, most tailored care possible, doesn't it?
It really does. Understanding those breed-specific risks is huge.
Well, thanks again for sending in all this material for our deep dive. We certainly learned a lot today.